hear from in a few minutes is the Deputy Attorney General of the Department of Justice. And for those of you who don't live with a scorecard in your hand like I often do of who's who in government in Washington, that makes him the #2 ranking official in the Department of Justice, working directly with Attorney General Eric Holder. We call the Deputy Attorney the DAG in Justice talk, and some of his responsibilities include the fact that he directly supervises and the director of the FBI reports directly to him. The director of the Bureau of Alcohol, Tobacco, and Firearms reports directly to DAG Cole. Also, the administrator of the DEA and the head of the U.S. Marshals Service. And in Washington, the heads of all of the divisions inside of the Department of Justice, including the Office of Justice Programs that I know many of you receive grant funding from, they all report directly to Jim Cole. All 93 of the U.S. attorneys, my colleagues nationwide, we report directly to the DAG as well. Y'all, that means that he's my boss, so please be nice as you talk to him today. But despite his heavy responsibilities, this is not the first time that Jim Cole has been in Birmingham. In 2011, he spent an entire day here at the funeral service for Reverend Shuttlesworth, one of the icons of the civil rights movement in this community. And I think he heard a lot about the history of the community and got a real sense of who we are down here. He came back in 2012 and spent another day here in Birmingham and also at Talladega, learning about the problems we faced with ex-offenders, with high rates of recidivism, and how the community was taking those problems on. And I tell you that he has been here those 2 times to let you know that despite his tremendous responsibilities in Washington, he has always made time for us here. I think that's because in his heart, Jim is still a prosecutor. He spent 13 years in the Department of Justice as a line prosecutor early on in his career. He would have fit in well in my office because his specialty was public corruption, an area that we do a lot of work in Birmingham. And in fact, Jim prosecuted for public corruption 2 federal judges. Even after he left his time with the Department of Justice, he was still held in high esteem, serving as the special counsel for the House Ethics Committee in the investigation into then Speaker Newt Gingrich's issues that surfaced at that point in time. And so his roots are very deeply as a prosecutor. That means that he understands the work that we do in my office. He understands how critically important it is for us to have the tools that this panel discussed to investigate the bad guys, to put the real bad guys, the traffickers who bring heroin into our community, to put them in jail and keep them off of our streets. He also has a very refined understanding of the use of evidence-based methods in the community to deal with addiction, to deal with treatment, to deal with many of the responsibilities we're going to have to take on as a community to fight addiction. So I am very interested in hearing what advice he has to offer us, the words of wisdom he has for us today, and I want to welcome Jim Cole to speak to us.
This is incredible because we really need this kind of awareness. We need this kind of concern. We need to have professionals, community leaders, law enforcement people, and citizens all here to talk about this. And while I'm pleased to be here today, the issue that brings us together, which is prescription drug and heroin abuse, is not a happy one. Unfortunately, the need to address these problems has become critical. But the way we begin to deal with it is to come together as a community to better understand the symptoms and the underlying causes of the problem. With the community, family, and friends aware and engaged, we get that much closer to practical and sustainable solutions. As the Attorney General recently observed, heroin and opiate addiction and abuse is impacting the lives of Americans in every state, in every region, and from every background and every walk of life. You've experienced this crisis firsthand here in the Birmingham region, where you have witnessed a more than five-fold increase in heroin overdose deaths between 2008 and 2012. That rate is nothing short of tragic, and it cannot be tolerated in our neighborhoods, and it cannot be tolerated anywhere in our country. Communities like yours across the nation are grappling to find solutions. In Cleveland, Ohio, the community came together last fall for a day-long summit, much like this one, hosted by the Cleveland Clinic, the United States Attorney's Office, and other state and local health care and law enforcement leaders after they had witnessed a 400% increase in heroin-related overdoses. They generated a plan to address every aspect of the problem, including education and prevention, healthcare policy, law enforcement, and treatment. As part of that plan, the Cuyahoga County Prosecutor's Office produced a website called letsfaceheroin.com, and it looks to increase awareness and understanding of the problem, and it offers support and it offers resources to those in need in the community, including young people, parents, community leaders, and current users. In Vermont, the family of a heroin overdose victim joined with the United States Attorney's Office to create an award-winning documentary, The Opiate Effect, to educate people about the realities and the dangers of opiate abuse. Clearly, part of the solution is prosecution. Here in federal court in Birmingham, a 20-year sentence was just handed down last month to Harold Mims for selling heroin that resulted in an overdose death. There is also ongoing prosecution of Patropius Foster, who was charged with distributing heroin that resulted in the death of Baker Mims. We just heard from Baker's family, from Ronnie and Beverly, and his sister Olivia was here. And we heard from Tracy Bynum, whose daughter Madison had also died of an overdose. And I want to offer them and their families my sympathy. We were all sitting in the room touched to our souls by what they had to say. And I want to give them my gratitude and I want to give them my respect, but I also want to thank them for exhibiting the strength and the courage to stand up here in the midst of the pain that we all know they felt, to talk about the tragedies they had faced, and to tell us, though it must have been very hard for them, what they knew about it, to give us some tools that we can use and that everyone in the community can use so that we can hopefully avoid the pain that they felt. They deserve all of our gratitude and all of our thanks, and this is where the solutions to the problems truly begin. Now, while we can prosecute cases like the two that I talked about, and hundreds just like them around the country, I want to make it clear that what we face is not just a crime problem. It is a nationwide public health problem, and it is a community problem. And everywhere people look at this problem around the country, they come to the same three conclusions. There is no single answer. We cannot stand by and do nothing about it, and we cannot arrest and prosecute our way out of it. This issue demands that we all join together to employ a comprehensive strategy that addresses every aspect, every phase, every cause of this crisis. The heroin use and the overdose epidemic gripping this country has its roots in more than a decade of prescription drug abuse. As the Attorney General recently had remarked, and I quote, "Increase in heroin abuse is a sad but not unpredictable symptom of the significant increase in prescription drug abuse over the past decade." Abuse of prescription drugs leads to dependency, and that dependency leads to the demand for more prescription drugs. That demand, users find, ultimately cannot be satisfied by the harder to obtain and the more expensive prescription pills. That's where the heroin problem sneaks in. The ready availability and the lower cost of heroin makes it an easy and a cheap alternative with tragic consequences. Now, don't kid yourselves. We heard that from the parents. Don't kid yourselves into thinking that the pills to heroin epidemic won't come to your neighborhood or your family members or your church or your school. This problem does not begin on the street or in a prison. More often than not, it begins at home. Even in the homes of those closest to us. More than half of all prescription drug abusers first obtained pills from their friends or family members, often by just raiding the medicine cabinet in their house. And no one should think that the size of their wallet, or the size of their house, or the extent of their education is going to protect them against the heroin epidemic that's in their communities. The demographic of prescription drug users has broadened and is hitting all demographic and all socioeconomic and all geographic segments of our society. As a result, the growth of this problem is staggering. I don't want to give you a lot of statistics, but there's some you need to hear. Just as an example, just among women, between 1999 and 2010, there was a 400% increase in the abuse of prescription painkillers. Among people 25 to 64 years of age, drug overdoses cause more deaths than car accidents. Every day in this country, every day, 105 people die of a drug overdose, and nearly 7,000 more are treated in emergency rooms. In 2012, approximately 6.8 million people reported abusing prescription drugs in the prior month. As a country and as a community, we cannot sustain this path. And as you've heard, there is an inevitable lead and path from the prescription drugs to heroin. Heroin use and the overdose epidemic follow swiftly in the footsteps of the prescription drug abuse problem. In a survey between 2008 and 2010, 81% of the first-time heroin abusers had previously abused prescription drugs. The number of heroin abusers has seen a dramatic increase in the past several years. In 2012, the number of heroin abusers had doubled compared to 2005 in this country. More than 156,000 people reported using heroin for the first time in 2012. Perhaps the most troubling, the age of the first-time heroin abuser is decreasing. And predictably and tragically, the increased heroin use has led to an increased number of overdose deaths. DEA has reported a disturbing but unfortunately logical trend in the heroin marketplace. Mexican drug cartels have significantly expanded their production of heroin and their distribution of it in the United States. And heroin traffickers are moving into areas with existing prescription drug abuse problems. Like any business, they find the demand and they go and they meet it. Prescription drug abusers who have recently switched to heroin are the most vulnerable potential victims. They're typically inexperienced users, more often younger than the average drug user, and they have a low tolerance for the dangerous effects of heroin and are unfamiliar with the purity of the drug or the strength of the drug. These problems are exacerbated as the heroin that's available in our communities has increased in purity and in many cases has been mixed with other drugs or substances that not only dramatically increase the effects of heroin, but also increase the risks of overdose. So why is the Department of Justice involved? Why did I fly down this morning from Washington to talk to you about this? Because we need to sound an alarm. Today, our children and our grandchildren and our friends and our neighbors are abusing prescription drugs. But far too often, and unless we act soon, they will be tomorrow's heroin overdose victims. I'm here to elevate this issue to a national platform. We are seeing across the country that a comprehensive public health strategy to address the heroin and prescription drug abuse and overdose crisis must include education, prevention, enforcement, and treatment. And to be successful, we must enlist the combined efforts of doctors and healthcare providers, educators, community leaders, law enforcement officials, faith-based groups, state and local public health officials, and friends and families of drug abusers. Here in Birmingham, the United States Attorney's Office has worked with federal, state, and local enforcement authorities to attack the supply side of the heroin problem, prosecuting more than 50 people in a collaborative efforts that focused to target the dealers and their sources of supply. Nationwide, DEA in 2011 has opened more than 4,500 heroin-related investigations. As both a sign of the increasing problem and the efforts that we are making to combat it, the amount of heroin seized along the southwest border has increased more than 320% between 2008 and 2013. But I don't want anybody to think that what we're talking about is simply a problem of drugs coming across our border or another country's bad actors harming us. This is an American problem through and through. Make no mistake, the practitioners who illegally dispense prescriptions, those who operate pill mills for prescription painkillers, and the pharmacists who fill those prescriptions, knowing their true purpose, are drug dealers no different than the street-level heroin dealers that we see. They may look different than a Hollywood image of a drug dealer. They may even be our friends and our neighbors, but they contribute to the problem just as much as the person selling a $10 bag of powder on the street. Which is why, in addressing these issues, we must confront the problem of prescription drug diversion if we ever hope to reduce the number of heroin users. We confront this problem initially with education and with supply reduction. DEA educates doctors, pharmacists, and other healthcare practitioners in the identification and prevention of prescription drug diversion. The DEA Office of Diversion Control has conducted dozens of pharmaceutical diversion awareness conferences, and one is actually coming to Alabama next year. DEA has also worked to address the problem of prescription drug availability in the home. It periodically conducts nationwide prescription take-back days. Just this year so far, 780,000 pounds of prescription drugs were destroyed. And since 2010, we've destroyed more than 4.1 million pounds of prescription drugs. Every prescription painkiller like this that is taken out of the medicine cabinet is one less pill that can end up in the hands of a young person and start them on a path to heroin. DEA also uses tactical diversion squads for enforcement, and there's one here in Birmingham as well. Their primary purpose? Investigate, disrupt, dismantle diversion schemes, pill mills, rogue clinics, and pharmacies and doctor shoppers and prescription forgery. But we realize that even with all of these enforcement efforts, drug abuse and overdoses will continue to occur. And this is where you, the parents, the friends, the educators, the medical professionals come in. You must be educated on the early warning signs and the key indicators of abuse, and you must realize that the most caring thing that you can do is intervene. Early detection, early intervention has been demonstrated to be one of the most effective ways to reduce long-term substance abuse. We can also help by taking advantage of proven methods of treating overdoses and saving lives in emergency situations. The drug naloxone can reverse the effects of heroin and opiate overdoses and has proven to prevent overdose deaths. More than 10,000 overdoses have been reversed using this drug since 2001. In Quincy, Massachusetts, they have traced a similar and faced a similar heroin epidemic. After police began carrying naloxone, overdose deaths dropped 70%. New York earlier this year, the State Assembly unanimously voted to distribute and use naloxone with all of their law enforcement personnel. But we also know that our work must include breaking the cycle of addiction and crime. By treating drug addiction as a disease instead of a crime, we provide better outcomes for both the defendant in the case and the community. And that's why the Department of Justice is supporting more than 2,600 drug and specialty courts around the country to connect over 120,000 people convicted of drug offenses with the services and the support that they need to break the cycle of drug abuse and rejoin their communities. Unquestionably, these problems that bring us together here today are daunting. They present us with a challenge whose scope and deadly consequences are like nothing we have ever seen before. But we have no choice. We have to deal with these and face these issues head-on. And not just with a single, one-dimensional approach, but with every tool we've got. It's that important. And that means it's the responsibility of each and every one of us to do our parts. Parents, brothers and sisters, aunts and uncles and grandparents need to step in when they see a family member going down a dangerous path of drug abuse. Teachers and coaches need to sit down with a student who's lost his way and counsel them. And all of us, young and old, need to overcome the discomfort of confronting a friend who we see is in trouble. Because without that loving confrontation, that trouble just gets worse and can end up with our losing that friend. As much as I'd like to, I cannot stop this problem today or tomorrow. But I can commit to you that we at the Department of Justice are dedicated to joining with you in a search for a comprehensive solution. And I truly believe that with sustained and committed effort by all of us, we will find those solutions, we will stop this crisis, and we will emerge a safer, a stronger, and a healthier community and nation. Thank you so much for all you're doing in this effort. I appreciate it.